So now we're going to start testing the balance system, and we're going to start with the Romberg. The Romberg was developed to test tabes dorsalis, or dorsal column disease. So it's a great test for peripheral neuropathy. It's not a great test if you're trying to test for the use of vestibular information for balance. And so what she's going to do is stand with her feet together, arms across her chest, and I'm just going to time her with her eyes open. We typically go for 30 seconds. I'm not going to go that long today. I'm looking to see if she can maintain this. But this is just baseline. If she falls during this condition, it's really an indication that there's a motor problem. The next thing I'm going to have her do is I'm going to have her close her eyes. And again, I'm going to go for 30 seconds. Again, I won't do it today just for the sake of time, but I'm looking for sway. I'm looking if she falls. If she falls during this condition, she's having trouble using somatosensory information for balance. Remember that on a firm surface with eyes closed, she should primarily be using somatosensation. So if she falls here, there's a peripheral neuropathy. Okay, you can open your eyes and put your arms down. The next thing I'm going to have her do is single limb stance. And we do want to try both legs. And so you can start with whichever one you want. And so I do want her to stand bending the leg up, not touching the other leg. And I want her to hold it as long as she can. Again, we want to go till about 30 seconds. I'm looking for the amount of sway. I'm looking for trunk movements, arm movements, leg movements. If any of those start, I stop the time. Okay, let's switch legs. Good. And again, I want to do both legs and see how she does. The inability to maintain single limb stance for about 5 seconds is indicative of fall risk in older adults. It also has been shown that in people with low back pain, they'll have a decreased ability to stand on one foot, especially on the involved side. Okay, you can stop. The last thing we're going to do is what's called a sharpened Romberg. It's basically standing in tandem, so one foot in front of the other, heel to toe. And again, we're going to do this primarily eyes open. This isn't normal to be able to maintain this with eyes closed once you start getting older. So we're going to do it eyes open, again, time for 30. You want to do it with the dominant foot both in front and behind. It should be more difficult with the dominant foot in front. So again, 30 seconds. Now go ahead and switch feet and then stand. Sharpened Romberg, again, is testing more somatosensory, but it also tests motor. You have to be able to use a hip strategy to really maintain standing in tandem.